Brad Williams, Frugal Finance, average cost of Medicare Advantage plans in 2025. This is a moving scale. Keep that in mind. In 2025, the average monthly premium for Medicare Advantage plans is set to decrease slightly to $17 compared to $18.23 in 2024. However, other costs related to these plans are on the rise. For example, the average drug deductible for Medicare Advantage is expected to increase significantly, rising from $146 in 2024 to $306 in 2025. Wow. So your premium drops by $1.23, but your deductible increases twofold. Makes a lot of sense, doesn't it? Additionally, the maximum out-of-pocket cost is also going up from $13,300 in 2024 to $14,000 in 2025. Here's a tip. Review Medigap insurance. Take a look. I know your premiums are going to be higher, but if you end up in the hospital, this 13 grand is going to be attached to you pretty quickly. I know this is on the high end here. You can find Medicare Advantage policies that the max out of pocket is $4 grand. But again, there's got to be some limitations. You, as an individual, have to determine what's the probability of you ending up in a hospital for 3-4 days. That's going to be $75,000 to $100,000. And if you have Medigap insurance, I know up front it's going to be a bit of a burden. But can you imagine paying 20% copay plus this MOOP? Okay, well, let's just say it's $9,000. Are you prepared to pay that? Versus $2 grand a year for Medigap insurance. Just worth evaluating. Medicare Advantage Part C plans are offered by private insurance companies that are approved by Medicare. These plans combine benefits from Part A, Part B, and Part D. Medicare Advantage plans tend to have lower out-of-pocket costs compared to original Medicare and may offer additional benefits such as vision and dental coverage. However, some plans require members to use in-network providers and obtain referrals for specialists. National average Medicare Advantage cost? Well, average premiums for Medicare Advantages are decreasing slightly. Other costs, like drug deductibles and out-of-pocket limits, are increasing. The annual drug deductible for Medicare Advantage drug plans, for instance, is increasing by more than 100% from $146 in 2024 to $306 in 2025. The following table highlights the average changes in cost between 2024 and 2025. Now, your monthly premium, this is a disguise, okay? Because in the end, you're going to have these in-network and out-of-network. And right here, this maximum out-of-pocket, you could see the numbers are just out of control. Your overall costs with these Medicare Advantage programs are in favor of the insurance companies and definitely will put a burden on you if you use these particular types of Medicare programs. According to the Center for Medicare and Medicaid Services, around 60% of people enrolled in Medicare Advantage will pay zero premium in 2025, although they may face significantly higher out-of-pocket costs. About 83% of enrollees will either see no change or reduction in their premiums if they stay in the same plan. Medicare Advantage premiums vary by states. Premiums for Medicare Advantage also differs depending on where you live. For example, the average premium in Florida for 2025 is just $4.33, while in New York it's $42.90. The following table shows the variations in Medicare Advantages across different states. This is a real pain in the butt. If you go through the Medicare choices for the different plans, and it's extensive, that alone is a study in complexity. Going to need to sharpen your pencil and do some number crunching. This premium, as I stated, is a disguise. What you need to look at are the copayments, the coinsurance, along with the deductibles, along with your premiums, along with all of the other hidden costs, and determine what's the best program. First, try to find the best Medicare Advantage program, then compare that with the best Medigap program, then determine what you think the probability is of not having to pay any hospital-related costs. No, that's one of those impossible tasks. Lastly, what's your income? If you're forced to use this Medicare Advantage premium, it's because perhaps your income is limited, and subsequently try to pick the best Medicare Advantage program you can that will fulfill your requirements without you facing undue hardship because you can't pay a huge out-of-pocket expense. These variations in cost can be attributed to several factors, including local healthcare expenses, subsidies available in certain areas, and the number of plans offered by insurers. Types of Medicare Advantage costs. When considering Medicare Advantage, there are several types of costs you may encounter, such as premiums. This is the amount you pay monthly for your Medicare Advantage plan. For 2025, the average premium is $17. Deductibles. The deductible is the amount you pay before your Medicare Advantage coverage starts to pay for services. This number can be extremely high. Drug deductible. For drugs included in Medicare Advantage, the deductible must be paid before prescription coverage kicks in. The 2025 deductible is $590. Copay. This is a fixed fee you pay for services after meeting the deductible, such as a $30 fee for a doctor visit. Coinsurance. This is the percentage of a service cost you pay after meeting your deductible. For instance, if your coinsurance is 20%, you pay 20% of the service costs. Maximum out-of-pocket. This is the limit on how much you will pay out-of-pocket for covered services. Once you hit this limit, your Medicare Advantage plan covers all remaining costs for the year. Factors that affect Medicare Advantage cost. Several factors determine the cost of Medicare Advantage plans, including types of plans. Most Medicare Advantage plans are either health maintenance organizations, HMOs, or preferred provider organizations, PPOs. HMOs typically limit you to in-network providers, while PPOs allow access to out-of-network providers at a higher cost. Location. Healthcare costs vary significantly from one area to another, affecting the overall premiums and out-of-pocket expenses. Insurance provider. Each insurance company sets its own premiums, deductibles, and other costs, so these figures can vary widely from one insurer to another. Medicare Advantage cost by insurance company. Here's a breakdown of the average cost for Medicare Advantage plans offered by different insurance companies. You have to use this word average. Aetna, $2,266, deductible $479, out of pocket $6,000. That's a big chunk of money. Elevance, Blue Cross, Humana, so on and so forth. You're going to need to check this number here. This out-of-pocket deal, that's a huge number, along with this deductible. And then you're going to have to use some common sense as to what you think is the best program. Medicare Advantage versus original Medicare, which is more expensive. When comparing Medicare Advantage to original Medicare, the cost can differ in several key areas. Premiums. The 2025 average premium for Medicare Advantage is $17. With original Medicare, you'll pay the Part B premium, which is expected to rise to $185 in 2025. If you choose to add Part D for prescription drugs, there's an additional premium. Deductibles. Original Medicare comes with separate deductibles for Part A and Part B services. Medicare Advantage plans may or may not have a deductible depending on the plans. Copays and coinsurance. Medicare Advantage may involve higher copayments for some services, and coinsurance rates vary. Original Medicare typically requires 20% coinsurance after the deductible. Out-of-pocket limits. Unlike original Medicare, which doesn't have a cap on out-of-pocket expenses unless you have supplemental coverage, Medigap, Medicare Advantage plans have a maximum out-of-pocket limit. For 2025, this is $9,350 for in-network services and $14,000 overall. How to find an affordable Medicare Advantage coverage? To find an affordable Medicare Advantage plan, consider Medicare, Medicaid plans for those who qualify for both Medicare and Medicaid. Special needs plans for individuals with chronic conditions or disabilities. PACE, programs of all-inclusive care for the elderly, or individuals who need nursing home level care but wish to live at home. An extra help program for those with limited income to reduce prescription drug costs. The bottom line, while Medicare Advantage premiums were slightly decreasing in 2025, other costs like drug deductibles and out-of-pocket maximums are rising. It's important to carefully review and compare plans to ensure that you select the most affordable options based on your needs. This is not an easy choice. Comment if you have any tips, if you're an expert in this area, if you have any advice. Brad Williams. Frugal Finance. Thanks for watching. Hope that helps. See you soon.